Hi, I'm Julie.
And I'm Caleb. Welcome to Nursing You, the podcast where we redefine nursing in today's healthcare landscape. Join Julie and I as we step outside the box on an unconventional healing journey.
Together, we're diving deep into the heart of nursing, exploring the intricate relationships between caregivers and patients with sincerity and depth.
Our mission is to create an open and collaborative experience where learning is expansive and fun.
From the psychological impacts of nursing to the larger implications on the healthcare system, we're sparking conversations that lead to healing and innovation.
We have serious experience and we won't pull our punches, but we'll also weave in some humor along the way because we all know laughter is often the best medicine.
It is, and we won't shy away from any topic, taboo or not. From violence and drugs to family and love, we're tackling it all.
Our nursing knowledge is our base, but we will be bringing insights from philosophy, religion, science, and art to deepen our understanding of the human experience.
So whether you're a nurse, a healthcare professional, or just someone curious about the world of caregiving, this podcast is for you.
One last thing, a quick disclaimer before we dive in. While we're both registered nurses, nothing we discuss here should be taken as medical advice. Always consult with your doctor or a qualified healthcare provider for any medical concerns you may have. The views expressed here are our own and don't necessarily reflect those of our employers or licensing bodies.
So let's get started on this journey together. Welcome to Nursing You, where every conversation leads to a healthier world. It feels good to be here, finally, and we're going to talk about our journey into nursing and our journey into doing this podcast, Nursing You, and how that kind of came about, starting with how we became nurses and what led us into kind of where we are right now. And that may take 1 or 2 or 3 or 4 or 5 podcasts, but we're going to do it.
It might take 1 or 2 or 3 or 4 or 5 years.
It might take
to get
all
the way through it.
Yeah, for sure.
It seems like every time that I tell any story that has nuance and detail, it is almost always told differently. You could sit down and have this conversation 10 times and slightly different variations of what you remember or how you remember it come out. And I think that's the value of what we're doing.
Well, and I think that's the value of storytelling. I think you tell the story differently every time, and depending on who's listening, there's just different nuances, and every person who listens to the story at that particular moment is going to pick up on something different. Right. And so right now, we're just going to tell our story today, how it comes out. And I think that who it will resonate with, they'll know. And, each time we tell our story, speaking from the heart, it just comes out as it will, And so we can just start by, you can start as far back as you want and take us on a little journey of how you decided and how it became that you decided to go to nursing school.
Well, I kind of feel like, because of our working relationship and because you have been a nurse longer than I have, and the roles that we started in, you were someone that I looked up to and respected and viewed as the leader. For as long as we worked together, you were always the leader that I looked to.
Well, I think we all have a mama.
Yeah.
As nurses, you all have the mom who is your mom at work.
Right.
I think I've been a mom to a lot of people. I had a lot of moms.
Yeah.
So I appreciate that. I understand that.
Yeah.
So would you like me to start?
I would give you the lead to share your journey first.
Yeah.
And then I'll jump in and share mine.
Yeah. My mom was a nurse. And I think that's a line that runs through a lot of nurses' families. It's a family kind of thing. My mom, that wasn't her first career. She was a teacher and she taught school and then she raised us.
What kind of nurse was she?
She was a labor and delivery nurse for a long, long time. She was also a psychiatric nurse in a psych facility. She was like director of nursing, something there. And she ended her career in like doing IT and electronic medical record and being with some companies, transferring records and getting them all digital.
So did you said companies, was she one of those nurses that stayed with the same institution for the duration of her career?
No. When she was in IT, she worked as like a contractor for different companies. So she worked as a contractor that maybe Cerner contracted. She actually worked for the VA system, contracted her company to get their electronic medical records. Some other smaller companies like down south, because most of the work was remote. And because she was building the electronic medical record to look like it does on paper, so that then those forms could be used digitally like they are now.
Wow, she was on the forefront.
Totally.
I mean, that's revolutionary stuff.
So, all the things that were happening, I mean, it might have been, what do you think, 10 or 15 years ago when the electronic medical record was like, that is where everyone is headed and you must be there by the deadline. And so that's kind of how she got into that, just, because nursing is backbreaking work and swinging those beds around and pushing patients is, you can only do it for so long. So I've seen her career and she thoroughly enjoyed being a nurse. She went to school to be a nurse right after my parents got divorced. So I was about 10. And so I remember her going to school, gutting it out, staying up late, studying, doing some of her clinicals at odd times. Being a 10-year-old, your eyes are wide open to what's going on. You're not really a baby anymore, and you're growing up, and you take in a lot of information. And
do you think your eyes were wide open at that age because they had to be? Do you think they would have been not so wide open?
For me, For me, my eyes were wide open. Being a child of divorced parents is a whole nother podcast. But I had to grow up pretty quickly and be very responsible for myself and my siblings. I was the oldest and supportive. Supportive of her, supportive of our family to get her through. It was a special time. I remember I can picture her getting her pin and her cap and, her cap and all that. And so I'm pretty sure that just implanted in me those memories. I have good memories of it, even though it was stressful and, there was a lot of change going on at that time. But from then on, I didn't really think about being anything else. It was just, I'm going to be a nurse.
Was it, as I'm listening to you, it kind of feels like you were watching your mom go into this world and that you had to do the same thing that she was doing only for your siblings. And so you were seeing mom go take care of people. So I have to take care of these people.
Yeah.
So maybe someday I could take care of people like mom takes care of people. Something like that.
Yeah. Yeah, for sure. I don't remember thinking in my mind, I don't know if 10-year-olds do, but that I was going to have like a career, but I definitely was caretaking. I was caretaking for her. I was caretaking for, my younger sister and brother. And I think it definitely developed part of my personality like that, because I am definitely a caretaker and have flourished in that, not only in my career, but in my family and friends and, sometimes to a detriment, still trying to find balance in that, wanting to care for others, needing to care for myself. But it just becomes a river that runs through you, and you can't, it just is. And so you have to figure out how to manage it and sometimes go across it, sometimes go down it. Sometimes it feels like you're going upstream, So when I got into high school, there was a class or path, or I don't know what you would call it, called health careers. I think I was maybe a junior or a senior, but again, even my jobs in high school, I babysat, and so I was just caring. I was still caring for my siblings, doing that. So it was just the nature of who I was, I think. But I started in that health careers, and we got to shadow different units and different places, community things, as far as, I think the instructor of that course was very tapped into the community of, we went to a middle school that had for disabled kids. We went to the burn unit at KU. Wow. We went to an ER downtown.
That sounds crazy for in high school.
Yeah.
Wow.
I know.
Yeah, it seems crazy. I mean, only with the context of having worked in those settings.
Right.
Like I would never want 16-year-old kid
I know.
to go into any of those places today.
Right.
That's crazy.
I know. And I think I felt energized by it. I felt, because we had a lot of autonomy in that. Like, we would leave half the day. We would leave maybe at lunch, I think, and would spend the afternoon at these different places so she would set it all up. We would go check in, and then we would be there for the 2 hours of the last day of school. And then you leave and you go home. So it was very grown up. It was very, and I felt important. And I felt, like that's just who I was.
Yeah.
Yeah.
It's important work.
Yeah.
Like, I'm important because I'm doing something important.
Yeah. And, I always felt important, and that it was necessary to use my skills to help other people. And that was a perfect way for me to, utilize everything that I felt inside my body. And so when I graduated high school, it was a rough time family-wise. And so there were some complications. I went to JUCO for a semester, pre-nursing classes. I think it was just, whatever, English and that. And then I really wanted to go to KU. And so then in that spring semester, I did go to KU, and again was just in some like general studies. And things got a little crazier in my personal life with family and that. So I ended up moving to Nebraska, where my dad lived and where I grew up, and went to the University of Nebraska at Kearney. That's where my dad, he was a professor there. And once I got up there, I don't remember why I felt it, but I felt like I wanted to be a doctor. So I enrolled up there. I was in for 2 years in like pre-med courses and the beginners, the calculus, and it was hard. This whole time, though, running down the river, I was a CNA. So I got my CNA in high school. Not in high school. I was about 18. So it was right after high school. I don't know if back then you could get it in high school. These days you can. So I started working in nursing homes. And so I always worked as a CNA. That's just what I did. And all the way through school. But after the 2 years at Nebraska in the pre-med courses, that was too much. Yeah. And again, another life change, things happened around there, and I moved back to Kansas City, and that was in 95. I graduated high school in 91 because I'm 50.
We're there.
Yeah. And came back here and just had to get my feet on the ground for a bit. So I didn't go to actual nursing school till 98, and then I graduated in 2000. Wow. Yeah. So I worked at, it's not even there anymore. What was it called? I don't know, a psychiatric hospital that my mom worked at. And so I got a job as a tech there, which was weird and interesting. I don't know if I liked it as much as working in a nursing home. I think I liked taking care of old people versus mental health.
Yeah.
I don't know. Just felt more comfortable there. But so then I just took some prerequisites and then started nursing school in 98. I did work at a local hospital, started there in 96. So I worked a year in psychiatric, and I think I might have worked at a nursing home too during that time. But in 96, I started at a local hospital here as a tech in the ICU at nights, and took just a few of my classes. I got married in 98 and then started at KU Medical Center in the fall of 98. And I never really, I was always pushing forward. I was always pushing for that. Like somehow that was where I was being pushed, and I didn't really question it. I just did.
Right.
Yeah. I enjoyed working in the ICU. I enjoyed that. It's hard to describe the feeling of being near someone who was literally life or death. Mm-hmm. There's really nothing else like it. And so I started in 96. I was probably like 23, maybe. Like,
back up, that experience of being at the, end of life care. Mm-hmm. You're talking about when you were that first year, or those first years. Like,
yeah. So when I first started working at the hospital, I was a tech, and so even as the tech in ICU, you're right there up close and personal with those patients. Right. And I did my first postmortem care there. Mm. I had all those nurses were like my mom. Yep. It felt very family oriented, which I'm so grateful for, because a lot of experiences are just not like that.
Yeah.
I just felt like I belonged and that this was where I was and this was right. It really did feel right. And then when I graduated, I just started there as a nurse in the same ICU. And again, I wasn't questioning much back then. A lot of it, I look back now and it was very autopilot-ish.
Well, there's a humility you have to approach it with.
Yeah.
You don't know anything at that time.
Yeah.
And so you're just collecting experience.
Totally.
Just, I got to grab this experience. I got to grab this one.
Yeah. And my mind was wide open. And so, I mean, I was just soaking it all in and really enjoying it. And I didn't even mind working nights. Like it was just, I felt like it was so easy and really just where I was supposed to be for what, and I look back now, 20 whatever years later, and it was where I was supposed to be. That is what I was supposed to be doing. Yeah. And so even though on autopilot, I was being guided. Sure. I feel. Mm-hmm. Yeah. And so I had a great time in nursing school. I had been a CNA and been around people and touching them and rolling them and cleaning them and bathing them and, being very familiar. And I just didn't really have any hesitancy.
None. I had a ton of hesitancy.
Yeah. we have quite opposite story. I mean, we really do. It's funny how we kind of both came to the same place having completely opposite stories. Yeah. I didn't really have any traumatic experiences. And maybe that's what led me to be a good leader, being very stable on my feet, stable in my mind, confident. I had a lot of confidence from the get-go. Yep. Even in nursing school, I was kind of the leader of our little group, and not in a crude or, I don't know, king way. Mm-hmm. It was more like a motherly, like, let me help you and let me show you that it's easy. And let me show you that I can do it. And so then you just mimic what I'm doing. Yeah. So even through nursing school, it just wasn't, it just wasn't challenging for me. I do remember being scared as a new nurse though. Mm-hmm. Oh yeah. Yeah. Especially starting in the ICU, I mean, you can be a CNA, but now that you're the nurse, now you are actually in charge of your patient. Yes. And I remember multiple times wanting to know who I was working with, making sure that I had backup, what my plan was going to be, going over things, and just the butterflies of, like, oh my God, like
all the pressure, the pressure.
Oh, but
it's all on me.
Yeah. It's scary.
It's scary.
It is scary. Yeah. And I tell new nurses now, even just, it is scary, but that is normal. So you're feeling exactly what you're supposed to be feeling, which is butterflies and like, I can't do this.
Yeah. If you don't feel that, like, something, you're dangerous.
Yes. Yeah. You're right. Yeah. Yeah. So, I think that although my experience was not super traumatic in those early years, as I continued to, be an integral part of the unit, your responsibility gets more and more and more. And it's just kind of a natural thing that happens. It's not really a decision, really. You're usually approached or you're just put in charge that night. You're like, like, oh my God. Okay. And the day charge is like, it's fine, Julie. I know she called in sick, but you're going to be okay. And I'm like, okay. Who's the supervisor on tonight? Lots of those. And then, the sticky situations you get in, and for some, you just manage to get yourself through it. And I mean, like, already my body, I can feel it, like just anxiety.
And I'm 100% right back there. In the unit
just
with you.
tense. And, although not, some more of my traumatic experiences actually happened later in my career, really. But I think the underlying current of the instability of shifts, all of the things that can go wrong or sideways, or, I mean, there's so many things that can happen to a unit that can cause it to go off the rails. It's always just right there.
So that kind of takes me to a thought that I play with intermittently, just that, our entire lives are built around this job.
Mhm.
Every facet of our life
Mhm.
is impacted by
Mhm.
the occupation that we have. And so on the one hand, we have this, we feel this tremendous responsibility to care for these people who are on, on their deathbed.
Yeah.
And we have this sense that we have truly objective tools that we can implement to save this life. While that is true, we have Levophed and all these drugs that really do work.
Mhm.
But at the end of the day, life and death is not in our hands.
Yeah.
And so we take on this responsibility, and I think it's easy to forget and carry this pressure that we're responsible for this life or death.
Yeah.
When in reality, it's not in our hands.
Yeah.
Like, it's just not.
No, it is. You're absolutely right. And if we could only have a little dose of that as a new nurse, that it is not your sole responsibility, that what is going to happen will happen, that you're working to the, maximum of what your knowledge is and what is available to you at that moment to save that patient's life, it still can have a bad outcome. And I think that's a piece of what starts to chip away at, not even chip away, it's a piece of what starts to build up that then becomes a burnout situation. So, burnout is such a vague term, but yet it umbrellas so much of where nurses end up. It's like you end up in this misfit toy aisle, and you're just screwed, but you're looking back and you're like, but I did everything right. I went to nursing school and I was a nurse, and you did, but it's like, it's so insidious creeping in, and looking back, I can see little pieces of, I'm like, that was part of it. That was part of it. And part of it, just as you said, was feeling responsible, 100% responsible. And then moving into a charge nurse role, you feel responsible for not only your patients, which most of the time you had being a charge nurse, everyone else. So the nurses and their patients. And the stress and the pressure of that is tremendous. And I didn't outlet that at all.
Well, you're not trained to outlet that.
No,
we're not taught how to outlet that.
Nobody talks about it.
Yeah.
Nobody talks about it. I think now they're talking a little bit more about it, and people,
we're talking about it right now.
We are talking about it right now. And I think there needs to be more people talking about it, and there needs to be more implementation of chats and talks and debriefs. And
why aren't debriefs mandatory across the board everywhere?
I don't know.
Why not?
I don't know. It should, just as they do like mock codes.
Yes.
They should do debriefing. Like, it should just be included. And I am sure that there are probably universities, major health systems that maybe have some of that in. If anybody knows about it, I would love to know, because that program, wherever it is, needs to be mimicked in every situation, in the tiniest of little hospitals.
Yes.
The tiny, tiny little critical access hospitals that are literally,
sometimes they get hit the hardest. I mean,
really?
the implement that lands on the guy's belly. And,
I know. I know. It's very scary.
Very
and so,
bad situations.
It shouldn't just be reserved for the systems that have the money, that have the means, that have the staff, that have the educator. I mean, there are so many places that it's just not provided, and those nurses are dying. I mean,
no,
some of them are literally dying,
peeling off the career path and going and selling insurance or whatever, or they're offing themselves.
Yeah.
And it's gotta stop.
Yeah. I mean, it really does.
Yeah.
And so, I think us telling our stories and then just having conversation, because I think, being able to talk about it, process it, is part of how we're going to nurse you.
Yes.
Yeah. So we've been taking care of people our whole lives. And, you have to take care of yourself. And you hear that all the time. And I ask myself, put your oxygen mask on before you put your kid's oxygen mask on.
Yeah.
And I mentally understand that, cognitively, I understand that. But the pull and the desire to not do that is crazy
Yeah.
because you just almost instinctively take care of the other person first.
Mhm.
So it's odd.
Yeah.
So it's not natural to turn in and take care of yourself, unless shit hits the fan and you're sick,
Yeah.
mentally or physically.
Right.
Because then you have to take care of yourself. You have to take the medicine, get help, whatever. But it's not instinctive.
I've been through multiple different healing courses over the last 10 years. And one of them had this exercise, and certain members of the group were given medicine and certain members were not. And they set up a scenario where people were like, other people that didn't have medicine were ill, and you had to choose who got on which train and which, or something like that. Who lived and who died.
Yeah.
And all of the people that were given medicine gave all of the medicine away. No one kept it.
Wow.
They gave it all away. And it was such a powerful picture for me. Like, I gave it all away. Yeah. And I didn't hold anything for myself.
Right. Same.
And we're all doing that.
Yeah.
It's crazy. It was just such a powerful picture.
Yeah, that really is, because it's so true. And it's super reflective of what's really going on.
I think it's a beautiful picture of the human spirit that we like, despite all of the madness and all of the hate that is happening. I think at the very core, I think we want to help others. Yeah. I think that's true.
Yeah. Oh, for sure.
Yeah. I mean, I think that's one of the things that you can take out of that example is that everyone there wanted to help everyone else.
Yeah.
Well, everyone that had medicine gave it away.
Yeah. Wow. I mean, that really is. I mean, and I think as a collective, that is our nature, is to help others. Mm-hmm. Our nature is not to help ourselves, which if there has to be some kind of a balance. Yeah. Because I didn't really start to heal until I started taking care of my inside, my inner self, and getting to know what that person needed. Yeah. And how I could help some of that suffering.
Well, I don't think there's any place that's part of the educational piece that is lacking from the nursing education is, I'm taking on all of these experiences, and where do I put them? Mm-hmm. Where do they, like, how do I make sense of this, this death? Yeah. I'll just generalize. Yeah. I have one death in particular that was my big trauma. And whenever I think of trauma, I think of that situation, and I had no place to put it. I had no frame of reference, no way to make sense of it. Yeah. And those build up and build up and build up until you don't know how do I even, like, I can't even look inside.
I know.
Because it's so full of just these terrible experiences that I've participated in and witnessed. And so, I mean, for me, I self-medicated and did things that my true self wouldn't necessarily do. Yeah. And I just carried that and carried it and carried it. Yeah. And we all are, I think.
Yeah. Well, we weren't taught that is damaging. Mm-hmm. We weren't taught anything. So we just did what naturally people do with traumatic situations, which is stuff it down and don't think about it because it hurts and it's weird and you just want to move on.
Yeah. So we kind of got off on a tangent there. We were talking about your career. So we got kind of, I feel like we got through your year as a tech in the ICU. Mm-hmm. We got into your first year of the staff nursing in the ICU.
So, life has to mix with it. And so right after, about a year after I graduated, I was pregnant with my first kid and had my first kid. I was still full-time. I was full-time nights. And so throwing a kid in the mix is real complicated. Oh, yeah. And there's no book and that says, okay, so now you're going to do this. So my natural thing was like, I got to be home with this kid. I can't work full-time, but bills. And so I went to the float pool and had a little more flexibility in my schedule, which, nursing has amazing flexibility
True.
with certain things.
With
There's a
certain
lot
things.
of doors you can open. There's a lot of turns you can take. There's a lot of places you can be to kind of make it your own. Again, I felt like I navigated that by myself. Nobody told me that.
Uh-huh.
I didn't have anybody saying to me, oh, well, Julie, here are all your options.
Mm-hmm.
It was more like, all right, okay, you're going to the float pool. We'll need to hire someone for your spot. It wasn't nurturing.
Yeah.
Oh, yeah. I could say a lot more about that, but I mean, being a manager and managing nurses is very hard.
Yeah.
And, I didn't have the mentorship, the mental mentorship that would have been great to have, So again, just I'm navigating all of that on my own, but I did feel good having a little bit more flexibility in my schedule. So I stayed PRN in the ICU for, I don't know, 3 or 4 years. And time warps for me. So I really, I have significant years. I'm like, okay, well, I know where my kids were born, and I can relate that back to what I did because I stayed at the same hospital from 96 to 2022.
Wow.
So that's a long time. I don't even know how many years.
That's a long time.
So I did everything, I did everything. I went to the float pool and then in ICU, and then I went to the floor in the float pool, and then I worked as a supervisor, and then I did like resource nurse. I mean, all those little jobs, they're always changing around roles and adding and subtracting and doing that. And I mean, it served me. It served my family. I think I stayed for so long because it was comfortable. It was easy. And looking back, I think I stayed because I was literally afraid and had fear of leaving and going to somewhere new.
Well, you had mothers, you had stability, you felt home.
Yeah.
Like that was, I mean, I came to work there 10 years after you started, and I definitely felt that same sense of belonging.
Yeah.
My friends are here. I'm safe here with these people because they know what to do and they're teaching me everything. And I think that that back in those days, it was still that way. I don't know that it's really that way anymore anywhere.
Yeah, right. I don't know. I'm sure there are some units that are amazing. And when we talk, we're definitely not talking about every single unit in the whole world.
Right.
We're talking, our individual experience at kind of where we were, that I think also mimics many other nurses' experience. I mean, you get on any nurse Facebook group, you hear the same things. Yeah. So, I mean, it does feel familiar. And there are times, seasons that during your career that are like awesome, and you have the best group. Yep. And then some of those leave, they grow up, they go to CRNA school, they whatever. Yep. And then you get kind of another wave of people and it's totally different. And the season is just different. Yep. But, the season that we worked together it was a good season. Yeah. Yeah. And it was a good group there. And, I tried my hardest to make it feel like that because that's what I needed. And so, I think it resonated with everybody else who worked, and, I felt needed. I felt like I was doing something good. Like not only was I caring for the patients, but I was caring for the nurses who were caring for those patients. I mean, I think that's my nature. And, I want everybody to feel good with what they're doing. And, but I think that takes a toll, sure. And especially when you're not really doing anything to nurture yourself, you will run out and you will dry up. Yeah. I mean, it just will happen. Yep. And, I wish that, to me, pivotal moment in my career was COVID. And that, up until then, I mean, I was kind of like, hey, this is fine. I was a little bored, but, it would have been fine. Just kind of take me out. Although my back and my shoulders, I was feeling it really bad. So I could tell, like, the pillows were turning, the soup was stirring, like something was moving, something was happening. The energy was definitely changing. Even in like 2018, I did go to day shift in 2018, and my personal life took a turn for the positive. I quit drinking in 2017, late in November. And then I went to day shift in 2018. And really from there, my nursing career was never the same. So I did a lot of different things in the day shift. There was several roles that, critical care charge nurse, resource back and forth to the ER, kind of, these little roles that they try out to try to help the situation that's literally drowning, and I was up for it because I thought, well, I don't want anybody else to do it. So I'll just do it. Yeah. I did take over as manager of a couple critical care units as someone left. And then I did kind of interim, which is usual, I think. I mean, they pluck from the unit. And again, there wasn't anybody else that I wanted to be in charge of me. So I might as well be in charge. And, I thought, well, okay, I can take this opportunity to do that. I
never had any desire to go into management. Nursing management just seems like.
And I always said I would never do that. I will never do that. But I thought, things are different. I'm on day shift. Like I can see it. The administration at that time was good. I felt like okay doing it. No one can even prepare you for the amount of work. And if you're not letting anything out and you're not even taking care of who you are, you throw the role of being a nursing manager on top of all that. Death sentence. Yeah. That's what it was. So I was slowly dying, but I didn't even know. It's so crazy it's real though. I've talked to so many people now. Again, there are managers who are amazing. Mm-hmm. They love it. They don't feel like I did because this is just how my experience. And I talk to other people, so I know it's other people's experience, although it's not everybody's.
It's like there's a different, because you're a leader.
Yeah.
Like in the unit, like you show up and everyone knows it's good, even if the outcome's terrible.
It's still going to be fine.
It's still going to be okay.
Yeah.
Because you're a leader.
Yeah.
And the different, there's a fundamental difference between a manager and a leader.
Yeah.
And you're definitely a leader.
Yeah. So I tried. It was just, and then that year we also had Joint Commission come and we had the state come, and it was just, it was just our year. It was just the year for that. And it was.
So I want to ask what your thoughts, you're just a natural leader and you were a manager. Mm-hmm. I've never taken on that role. Never wanted it.
Yeah.
Don't want it. Don't think I'll ever want it.
It's a whole different job than being a nurse. You are a nurse, but it is an entirely different job. You are not taking care of patients anymore. You're taking care of patients by way of taking care of the nurses with all of this pressure on you to get them to do good on the surveys.
Why are surveys so important?
Surveys are important because the reimbursement from Medicare and Medicaid are dependent on patient surveys and patient satisfaction. And so there are a plethora of questions and feedback that we get from patients, and that goes into like a chart, and whatever scores you have in each certain area, it allows you to get reimbursement from Medicare and Medicaid. And that's a whole podcast.
Yeah.
Yeah.
No, we need to have it.
And I'm telling you, nurses don't know this.
No, I don't know that.
No. Now, I tried to teach the nurses why I'm asking you to do this, why I'm asking you to do bedside report, why I'm asking you, to chart this and do audits and make sure the discharge in this time and all these things, all of these metrics that the hospital has to meet. It doesn't make any sense when you're just looking at the bedside taking care of the nurse like that. It doesn't matter to you like that. It doesn't matter, and it shouldn't matter.
So is there a differential for the patient that told me he was going to kill me? Does his patient satisfaction count?
His patient satisfaction actually does count.
It counts more?
Yeah. I saw something on I don't know, Instagram or something, and it was a little snippet of maybe a Twitter or something that a doctor wrote, and it said, "Thank God for Dr. So-and-so. He saved my life. 4 stars." And the doctor, he was like, "What do I got to do to get 5 stars?"
Yeah, right.
You didn't like the coffee? I guess you didn't like the coffee.
There was the coffee.
Yeah. I saved your life. You didn't like the coffee. 4 stars.
Oh my gosh.
I know. I could never wrap my mind around it. I just really couldn't. It didn't really make sense to me.
That doesn't make any sense.
No, it doesn't.
And it doesn't make any sense that that's how we're getting reimbursement.
I know.
That's insane.
I know. Yes, let's take a deep breath, because it's literally
The insanity.
it is insanity, and it feels just like another handcuff that nurses have to wear while they perform their duties.
Mhm.
And they're trying so hard to take the best care of their patients, but they are bound.
Mhm.
They're bound by staffing ratios.
Uh-huh.
They're bound by surveys. They're bound by patients' impression of them. They're bound. They're
Which
bound
is
by
so subjective.
Oh,
There's
it is
no way to
100%
validate
subjective. No,
that as a reality of truth. Or
no,
a
it
picture of
feels like a failing system. Like you're
Yeah.
always drowning, and you're always just treading water, because you cannot, it feels like you can't ever get ahead,
truth.
and that also is very stressful. And I think that's part of what injures a nurse's soul.
Yeah. Mm-hmm.
It doesn't seem right.
Yeah.
It doesn't feel
It doesn't
right.
feel right.
No.
I mean, I wasn't even aware of any of that.
Mm.
I've gone my entire career just kind of winging it, I guess,
Yeah.
in that
Yeah.
sense. I'm not striving
Yeah.
for, like, I want my interactions with my patients to be good
Yeah.
and positive,
Yeah.
but not because I need a survey.
Yeah.
Not because I need a survey score.
Mm-hmm.
Just because I want my patient, I don't want my work to be miserable.
Right.
So I want to come into my
Yeah.
patient care settings with a positive attitude and maybe do good for people if I can.
Yeah.
You can't always
I know.
do that.
I know.
But
And I mean, I think nurses, don't you think, innately feel that way? Like
I think so.
They come to work and they really just want to take the best care that they
Yeah.
can of their patients.
Absolutely.
But there's so many extraneous variables that they don't have any control over.
Mm-hmm.
And
Yep.
so you can do the best, you can save
Yep.
their life. Doesn't
Well,
matter.
I mean, that goes into, I kind of touched on it earlier, the objective. Like, we have this idea that medicine is objective,
Mm-hmm.
that science has worked itself out to such an efficient degree that every time we do this, it's this.
Mm-hmm.
And that's just not true.
Mm-hmm.
There's so much, I mean, especially, like, I think about this when I think about the life and death situations where we're in the ICU. This person, has a pH of 6.3.
Mm-hmm.
It's like, nothing's gonna work.
Nothing's gonna work. I'm
Nothing's
sorry.
gonna work.
Yeah, I'm sorry.
I mean, like, maybe get it a little higher
Mm-hmm.
into the 7s,
Mm-hmm.
where maybe there's some management that could be done
Mm-hmm.
to correct it.
Mm-hmm.
It still doesn't always work.
Mm-hmm.
Like, one of the examples that I use to make this point is hydralazine.
Mm-hmm.
That we give hydralazine as an antihypertensive, and we think that it works.
Mm-hmm.
It has worked. It's proven itself to work over time, but we have no idea how it works.
Right.
Look it up. Like,
Yeah, I know.
We don't know how it works.
Yeah. Look at that. Yeah.
And so there's this tremendous amount of subjectivity that goes into the daily practice of nursing, the practice of medicine.
Yeah.
But we treat it in our minds, societally, as this stalwart of truth.
Mm-hmm.
And I think that's part of that's part of the distrust for medicine,
Mm-hmm.
is that it presents itself as absolute truth,
Mm-hmm.
exacting truth.
Yeah.
And it's just not.
No.
And people see through that.
Mm-hmm.
And so the mistrust around Western medicine, I think, is somewhere rooted in the reality that it's not purely objective.
Mm-hmm.
There's tremendous amounts of subjectivity. I liken it to driving an old, Cadillac.
Yeah.
It's like floating.
Uh-huh.
You're floating
Yeah.
medicine.
Yeah.
You're not driving. I mean, there are Ferraris in medicine.
Mm-hmm. Yeah. Yes.
There are Ferraris.
Yeah.
Like the pinpointed radiology that we're doing,
Yeah.
that we're under CT scans.
Mm-hmm.
That's very precise stuff that we're doing.
Yeah.
And I'm fine with the reality, the truth of that objectivity,
Mm-hmm.
but in the broader sense of the totality of medicine and the perception of society as to what medicine is, there's a huge disparity.
Yeah.
I mean, I think Hollywood has educated society on what we're capable of,
Yeah.
and it's created unrealistic.
It's how it feels anyways. Yeah.
Yeah.
It does feel unrealistic and it does feel unattainable.
Mm-hmm.
And I think that's part of what builds up burnout is not meeting your expectations, not meeting the expectation of where it should be, kind of that chronic feeling of a failing, although your patient might have survived or maybe they died, it doesn't matter. But the feelings that come when you don't have enough staff, you didn't have the supplies that you needed quick enough, or you couldn't get somebody to come in on call, or, time, it took too long, or, all of those little tiny things that build up to significant experiences, it just adds to it. And because it's not anything you have control over. And I think that's a huge thing with nursing, is that there is so much that we don't have control over. When we're working within our means with our very smart brains, handcuffed half the time, and not having control over that is another piece to what causes, extreme burnout. You can be burnout from the week, or you do your 3 in a row and you're just so tired and you got your kids and, you're trying to manage everything. And that's tiring. But if you come back and you fill back up on your week off, or, you got 3 days off or 4 days off, and you spend time with your family and you're outside and you're, meditating and you're re-nourishing your own self, to me, that would ward off some of that burnout. But if you're not even aware that those are some of the things that will then cause you to have extreme burnout,
doing those things.
Yeah. So if you're not doing those things and you're just marching through,
pushing through,
it just will. It can't not. And then, you start getting bitter and you don't want to go to work and you don't care. And, I never had trouble with not feeling like I wanted to work when I was at work. I mean, I always felt like I always gave 100% effort to caring for my patients. But, there were lots of times that it just bled out into my life. So it didn't really even seem like maybe in the beginning that it was coming from my job or being a nurse or who I was. It just bled out into my life and into my relationships and my weight and my social choices and, numbing with, alcohol. And I don't know, it was just eating away at me, kind of unbeknownst. And maybe I knew a little bit, but I didn't know what to do about it. There was nothing I knew to do that I could change, because everything that was under my control while I was at work, I was doing all that. And I still, felt the need to care for other people and for patients and to make sure that they had the best experience and outcome, and that the nurses had the best experience. And, it was a lot of weight. It was a lot of pressure. And, then it felt 10 times worse being a manager, because I still felt the need to make sure the patients were good. But then I had sole responsibility for the nurses on my units, and so that was 2019 to 2020. And then it was COVID. And I mean, I don't even know what to say.
Right.
Like, it just makes me like, oh God, it happened when it did. And it is what it was. And it just ended my give a F. It just obliterated it.
Yeah.
I don't even have words. Done.
Yeah.
So done.
Yeah.
But I couldn't leave.
Yeah.
I couldn't just leave.
Right.
I just had to keep going.
I think that's kind of our generation.
Yeah.
I think we feel more of a pull to stay, to help, the camaraderie.
Yeah.
Like, I feel like maybe somehow social media or society, just the generational changes that occur because, times change, things change.
Yeah.
And we come from a generation that's pretty loyal, I think, in some ways, and not so much in others. But it seems like the loyalty to a unit or a group of coworkers just isn't there today.
I would agree.
I would agree.
Yeah.
like your desire to like, I can't leave.
Yeah.
Like they need me.
Yeah. Yeah.
Like,
and in a way, I needed that. I mean, I didn't know who I was without that. I didn't know what I would do, where I would go.
Totally feel that.
I couldn't picture myself doing anything else in any other place. I just literally couldn't see it. I couldn't do it.
I mean, I'm thinking maybe it's not a bad thing.
Right.
Maybe it's not a bad thing that these younger nurses aren't
I don't
staying.
No,
because they're not, like, I'm not putting up with that bullshit.
Right.
It's
so true. And so, right. In some of my last years, some of the nurses that would come through, the young ones right out of nursing school, they would come, stay maybe 2 years, do their little thing, maybe get reimbursement, tuition, whatever. And then go off and either get their master's or just like go somewhere else.
Yeah. Get to,
yeah.
And this doesn't feel right anymore.
Right.
Bye.
Yeah. And, at first
if we stay, we're in mud up to our hips.
And we're just waving. Yeah. We're just waving by. Like, I guess, see you later. It was. And I always wished those nurses, like, thank you for being here. Good luck to you. Almost like, I wish I were you.
Yeah. Good for you.
Yeah. I wish I could do that.
So, but then there's like the other side of that, where if I hadn't stayed and, had, endured some of the things that I endured to stay where we were, I wouldn't have the knowledge that I have, because those old nurses taught me everything I know. And how many people, like, I've had the answer to their problem because I stayed and I endured an uncomfortable situation, maybe longer than I should have.
Yeah.
But it definitely gave me something that I've given to others.
Totally.
So there's like this trade-off of experience and knowledge that, but then maybe it's a lack of trust that young nurse that stood up for themselves or made the choice for themselves and went somewhere else that was healthier, who's to say they're not going to meet somebody that has that experience and knowledge. So I think it's maybe a good thing that this younger generation is
it
not
feels,
staying.
Yeah. It's just a different season.
Yeah.
It just is. Nursing also had seasons, I mean, there were those, career nurses who, and I mean career, like they stayed in the same hospital, they stayed in the same unit, they were on the same committees for 20 and 30 years. You rarely find that. Nurses now that are graduating nursing school, they're different.
They're not.
And we were different a little bit from them too. Sure. But I don't know. After COVID, my body was dying. I had to increase my blood pressure medicine. I had to increase my thyroid medication. I had to get a sleeping pill. I had to increase my antidepressant medication, all of that. And you would think, isn't that a sign? Don't you want to do something? I mean, are you sure you're okay? But nobody asked me if I was okay.
Right.
No physician asked me if I was okay. He just said, "Oh, your blood pressure's high. We got to increase this and add this. Oh, your cholesterol's real high. Oh, we need to do that." Okay.
See, that's what I'm saying about the objectivity. Like, it's so objective and so lacking in, like, what's your situation? What is your experience that's driving all of this? Ill health.
And maybe I wasn't receptive either. I don't know what I would have said. I think I went to a doctor about my shoulder because it was hurting me so bad. I just knew it was torn. And so I finally went because I just didn't want to hear that it was torn and I needed surgery because I just didn't want to be out of work. But I finally went and he told me it was arthritis. And I was like, oh, well, okay. So it's just going to be like this then? There's nothing we can do? No, there's nothing you can do. You probably need to think about a different career is what he said.
Oh, well.
I don't know anything else. So I don't really know what to do with that. So I can't do that right now. But, that's just it. It just came to a place where it wasn't even an option to leave, until I was literally forced, I think. When I stepped down from being a manager, it was in the fall of 2020. And I felt horrible. I was actually going to go do traveling nursing in ICU for COVID. I was going to go to St. Louis for a contract. And that's a whole nother story. I felt so guilty not working in the unit and not taking care of those patients and making other nurses do it. I think part of that is why I had to quit being a manager, because it was hard being a manager, but the guilt that I felt having other nurses do what I felt like I should be doing was
tremendous.
Yeah.
I mean, it made me sick. I mean, I think it did. And so the only thing I knew how to do is we'll just go back and do that then.
Yeah.
So that's what I was going to do. I was just going to do that. But then that contract fell through for whatever reason, meant to be probably. And so I just went back to nights in the ICU at that same hospital. And I did that from, 2020 to just 2021. I just did that for a year in the COVID ICU.
Wow.
And then at that time, I mean, I was literally, I couldn't even hardly walk. My back was so bad. My shoulders, I mean, it was just, I felt like a 90-year-old.
Mm-hmm.
And so I took some time off and did physical therapy and some things like that. And really during that time off, I took about 6 weeks off because I couldn't really even walk. And I just had some realizations during that time that like, you do have to do something different.
Yeah.
You really do.
Mm-hmm.
And, it wasn't the first time that I thought about doing something different. I remember years and years back, I was like, I just want to work from home. Can't I just do a nursing job that I just work from home? I can just stay in my PJs and work on my computer. I mean, people do that, don't they? And nothing really ever panned out. And I probably didn't really pursue it.
Right.
I mean,
where do you even look for that?
I don't
job?
even know.
Yeah.
So
We're so pigeonholed.
we really are. And just a creature of habit. And I mean, it's how I became. I think it's what kept me sane during that whole time is just doing the same thing over and over and not making too many decisions. But I always had the pull of like, I don't want to, I didn't want to miss my kids. I didn't want to miss out. I was always missing out. I worked night shift and I had to leave at, 6:30 or 6:15, well, everybody's sitting down for dinner. Well, I got to go to work, I mean, it sucked. So
it's like our whole life is service.
Whole life is service.
Yeah.
And if I can just poured a little bit of that back into me and really thought, what do I want? What does Julie need? Mm-hmm. I never thought that. And things that maybe came to my mind, in my down journaling, it didn't seem possible. It didn't seem possible to change. I don't know. I just felt so stuck. And I think that's just from the career. It's just from, the little chronic, insidious baby traumas,
well,
baby
I don't
chronic
think you
stress.
Can know until you have to live the experience to you have to go through it to gain the wisdom.
Yeah.
You just can't, if somebody had told you, you need to do this for yourself and you need to do that for yourself, it wouldn't have landed the way that it does when you have to do it.
Yeah.
I got to do this. I got to do this for myself. I got to, setting boundaries for myself. Didn't know how to do it.
No. I just didn't because I think otherwise you just would.
Yeah.
Like I am now. I know how to do that. And I do that now.
Yeah.
So after I took that 6 weeks off, I mean, I literally didn't know what I was going to do. I was looking at lots of jobs. I knew I could not go back physically and work in the ICU. I couldn't do it.
Yeah. And
so I looked at a lot of different things and then a job popped up at the same hospital in case management doing like insurance review. And I thought, well, I had a good friend who used to be in ICU with us. And I was like, oh, maybe this will be awesome. Yeah. And so it was Monday through Friday, 9 to 5. Well, I loved working with her and I didn't mind the work, but it was just another, like a knife to the heart when you learn, so you just learned about surveys and how dumb that is. Well, I learned about insurance and how really dumb that is and how controlling it is and how disgusting it is. About the things that they will and will not cover and how much healthcare and the hospital systems and things have to fight with the insurance company. And that sometimes it just comes down to the heads playing a round of golf and like settling things out.
Wow.
And then the claims get paid.
Wow.
It's a whole other world. And
see, that's kind of one of the things that I see for Nursing You is going into some of these conversations to get to expand the awareness of what the system really is. Yeah. I mean, I know a little bit about insurance, enough to know pretty much everything you just said is
true.
Spot on.
Yeah.
And there needs to be some accountability. I mean,
well, and awareness is the first. I mean, it's the key.
Yeah.
Once you become aware and your mind becomes aware of a situation going on or how something really is when you never thought about it before. They don't teach nurses in nursing school about Joint Commission. They don't teach nurses about surveys and reimbursement from Medicare, Medicaid. They don't teach, they don't even talk about the fact that the insurance sometimes won't pay, or they'll, you get denied. And so therefore you have a discharge that day. They don't understand.
I didn't realize that.
And I don't even know if it's something that should be taught in nursing schools. I feel like it jades a lot.
I was going to say, there is anyone that goes into any form of caregiving is on some level altruistic.
Yes.
That they want to give.
Yeah.
We want to provide the care. Yeah. We want to be that person.
Yeah.
And if I knew, I feel like my ability to remove myself from any preconceived ideas of who my patient is or what their situation is allows me to provide non-biased care.
Yes.
Which allows me to be really more altruistic than if I had had some awareness of any of that information.
Yeah, just bias.
So there's this on the clinical, my clinical side says, I don't want to know anything about what this person's situation is.
Yeah.
I don't care what their money is. I don't care where they live. I don't care, what they believe, what they do. I don't want to know any of that. I want to take care of them, just touching the human soul.
Yeah.
I like that.
Mm-hmm.
I wouldn't really want to know there's part of me that doesn't want to know that other stuff.
Yeah.
Because then somehow I feel like it corrupts that truer form of altruism. I have nuanced thoughts on what altruism is.
Well, it definitely can manipulate the way that the patient is cared for.
Yeah.
I mean, there is manipulation.
Mm-hmm.
There has to be, or no hospital would make money.
Yeah.
So there has to be manipulation around what the insurance will cover for us to even take care of patients. So it's like a nasty part of it. And, for me, that was that was it. I felt so jaded. I felt so angry at the system. I felt like I was just a little pea pod in an ocean that had I didn't make any difference at all.
Mm-hmm.
That's really how I felt.
Yeah. God. Yeah.
It just felt so big, like this massive monster that I didn't even make a dent. That's how it felt.
I mean, I've thought you're connecting to something that I've thought a lot about. Just it's that altruistic part of us that desires to help.
Mm-hmm.
And once we have the realization that the help that we're giving is meaningless,
mm-hmm.
I think that's what, the system does when you see the scale and the scope of everything that's happening, and you realize that the contribution that you're making really is it's just a spit in the wind.
Yeah.
And for me, that was, realizing, the waves of death that
mm-hmm.
would come
mm-hmm.
through our
mm-hmm.
ICU.
Mm-hmm.
It comes in
mm-hmm.
there are nights that are just you're losing 3 and 4 people, and you got to fill the bag and
start over,
get them out, get them down to the morgue,
mm-hmm.
and get the next one in.
Mm-hmm.
And after you do that for a decade, you realize what I'm doing. There's just whether I'm here or not, it's going to be another wave.
Yeah.
And what I hear you saying is that you came to a place that you believed that what you were doing was meaningless.
Yeah.
I mean, I don't think that it is meaningless.
Mm-hmm.
I don't think the work that we've done is meaningless. But I do think that is one of the gateways to the burnout, really.
Yeah.
All the other junk that's piled in, then it doesn't mean anything.
I know.
Oh my God. I've given everything.
Yeah. That's exact. I mean, that's exactly how I felt. And I was like, I have to do something different. I have to do something different. Yeah. I have to get out of this. I have to create something on my own. I have to do something different. And it wasn't just quitting. I didn't want to just not do a NER. I didn't, because that was my whole career. It's what I knew and was comfortable with. and I couldn't take too big of a jump, but I definitely knew I couldn't do it anymore. And so I had studied to get certified in legal nurse consulting, and had kind of started up a little, business website, something like that, to try to get something going so that I could then eventually move out of the hospital. And so I did in the fall of 2022. But again, I took a PRN job, I don't know, fear maybe, because I just I didn't feel like I could just push off on, the legal nurse consulting full time. Cause you have to build your business and, network and things like that. And so I did leave the hospital, and just doing that for me was a breath of fresh air.
Mm-hmm.
Just letting go of all of my ties and my feelings of needing to stay and caretake. And, I just had to slowly kind of let that go. All the people that would pass me in the hospital, even when I was working in the case management office, because they were like, oh my God, I haven't seen you in so long. Where are you? Blah, blah, blah. I had to let go of all of that.
Uh-huh.
And I felt like I was letting people down, like, oh, okay, she's leaving. But really, that's not really what was happening. It was just something in my own mind.
Mm-hmm.
But that leaving and doing something different was the first step to me really, truly healing.
Sure. Absolutely. Yeah.
And, it's been just a year and a half, really.
Yeah.
It doesn't seem like very long, but, I started disconnecting from feeling so loyal, before I quit. It was, probably right when I started that job. I was like, okay, this will be for a little bit.
Uh-huh.
And I kept talking to myself back into like, oh no, you could totally be here. I love my boss. I love the people I work with. This is so great. 9 to 5, I can kind of come in when I want, leave, just do 8 hours here and there. It was very great. It really was.
Yeah.
And, the pay was great, and people were great, and lunch was great, but I think I was just too far gone by then, and I'm glad, I think it's brought me here. It's led me down this other path of healing and recovering, from a lifetime of just stress.
Yeah.
And the things that come with being a nurse, and I white knuckled it for a long time.
Yeah.
Not really knowing, not that I didn't feel strong or, like strong enough to reach out, or, why do you think we don't reach out sooner? Because we just don't know, or we're not ready, or I don't know.
I think we're just used to carrying the load. In the ICU, especially in a non-educational hospital, where it's super busy, people are super sick, very high acuity, and a lot of times, especially at night, you maybe got a pulmonologist and maybe a cardiologist that you have to wake up, and the rest of it's on you.
Yeah, it is. It's very heavy. Even hearing you speak that, it's heavy. Yeah. It's heavy on your shoulders.
It's all on you.
Mm-hmm.
You are the decision maker.
Yeah.
And that mindset carries over into everything.
Yeah.
I think.
Yeah.
You're just used to carrying the burden of responsibility.
Yeah.
Until you just can't carry it anymore.
Yeah. Well, and everybody has a journey into nursing. Everybody has a story. Everybody has, things that they've endured. Probably some even a lot worse than me.
Sure.
And then the family stuff that, the stuff that happens outside of your work, because of the kind of personality that you are and the type of job that you have, it just a lot of times just becomes a lot and then too much.
Yeah.
Yeah. And so my journey, which I'm glad for, and I'm not angry with it. Looking back, you could have been like, oh, well, I could have done this different, and I wish I'd done this, whatever. But really, it just leaving it for what it is, and respecting that, and respecting myself, and being proud of myself for enduring all that I did and making it through. I had several panic attacks, which I had never had panic attacks, but I had several during COVID. Watching CNN, it just feels like a bad movie, just constantly on the news,
right,
trying to figure out how can we keep these patients alive? Like, when is it going to end? It was so bad during, but looking back out of it now, I had to, it is what we went through. And so taking that and learning more about myself, how much I'm capable of handling, how strong I really am, being able to leave that where it is and then just focus on who I am and taking care of where I am and what I'm doing now. I mean, that's where my journey is now. I don't think journeys end. I think, this is a journey that you and I are on, coincidentally meeting, catching back up with coffee and you randomly asking me if
I think you asked.
I think it's hilarious that you think I asked. That's so funny. But I love it. However you remember it is how it is. And we just were like, oh my God, yeah, I totally thought about it.
Whichever way it went, it
really was meant to be. And so I think, getting to tell our story on a platform that can reach many, many, many people will hopefully help the whole collective. I think everybody should have a podcast. Yeah. Everybody should write a book. If you're not writing a book, you should at least be journaling about your life. Right. It's all through storytelling and nurses even do that, about their shifts.
Oh, for sure.
I mean, you story tell.
Oh,
you retell the story.
You retell it.
Yeah. And if you had a funny something, then you're in the break room and you're like literally retelling the funny story. And it's funny, or you had a really bad experience. And I think those are less talked about, but you do. The charge nurse talks about her night and tells a story of how that happened and how the night went and how staffing was and who had to go home and who was sick and who died and, what the staffing's like. I mean, it's all just a story. And, I've always thought that telling stories is a pathway to healing and, a way to nurse ourselves and to nurse other people. And, so I think our name of Nursing You is perfect for what we're here for and what we're here to talk about.
I agree. Mm-hmm. We hope you've enjoyed this week's episode.
Remember, the conversation doesn't end here.
Keep the dialogue going by connecting with us on social media posted in the links below or by visiting our website, www.nursingyoupod.org.
Together, let's continue to redefine nursing and shape a brighter future for those we care for. Until next time, take care, stay curious, and keep nurturing those connections.
And don't forget to be kind to yourself.